going to tell us a little bit about a very interesting unit of psychoeducation. She's the coordinator of the unit and about also group therapy, and that's in the Avicen service in Hospital Razi. I'm happy to have Dr. Hend Jemli because she's actually going to tell us a little bit about this recently launched unit working on psychoeducation, and we are really interested to know how does it work, this psychoeducation in the service in the Hospital Razi. And we know that Tunisians today are really focusing more and more about mental health in Tunisia and its importance to share actually lots knowledge in this context. So hi Hind and welcome in our studio.
Thank you. Thank you very much for having me.
Welcome. So here, this unit, which was launched in let's say 18th of October, it seems. And it is more about psychoeducation and group therapy. So can you tell us a little bit about it and what does it consist in? What's the methodology that you are adopting in this kind of, let's say, therapy or courses?
Those are very good questions. Thank you very much. So our unit, I would say, has been officially launched on the 18th of October, but we have been working long since before that. And I know that when you hear the term psychoeducation, it sounds complicated, but it's actually very simple. So our unit works to help people living with mental health conditions to learn how to A, know their mental disorder, and B, how to cope with it. So there are two components. The first one is knowledge. What are the symptoms? What are the causes of my disease? How does the treatment work? And the second part is skills. How can I learn to live with this mental health disorder? How can I cope with it?
Good. Really fantastic. So people who come to you already, they know that they are having certain troubles, psychological or mental troubles. So when they come to you, are they coming via a doctor or they come by themselves and they say, okay, I'm suffering from something and I would like to know what it is about?
Okay, that's an excellent point. So patients that come to our unit have been either addressed by their psychiatrist that has been following them and has diagnosed the disorder, but we are also open to voluntary participation, people who would like to participate in our programs and have not been referred by psychiatrists. So we do both.
Really fantastic. So let's understand a little bit the process. What does it consist in? I mean, this group, what is a group therapy is about, more or less? And what does it consist in? I mean, what is the methodology? Do you gather all the groups with having the same troubles, mental troubles or psychological troubles? Is it kind of a question-answer therapy? So we are really curious how things go.
Okay, so it is structured sessions with small groups. Usually they do have the same mental health condition, so it can be either depression, bipolar disorder, but also anxiety disorder, self-esteem issues, impulsivity or anger issues. And we do a combination of two things. We provide information, so evidence-based information, scientific information, but it's also a lot of practical skills. So we do a lot of role plays. We give them exercises from different psychotherapy types, such as cognitive behavioral therapy, that they will do at home. And at last, it's also a very free space where people have the chance to exchange with people who are going through similar things. And we know that they can be very empowering because mental health disorders can be isolating. So it's also a chance to get support from other people who understand what you are going through.
Oh yes, this is really fantastic. So what we can understand is that not only these patients or these people are surrounded by professionals, but also they are surrounded by peers, let's say mates. They have been going through the same situation, and I believe that this exchange between each other is going to make them more comfortable in trying to be, let's say, open to express yourself and to communication. But I think also you are managing with the families themselves, so you are not in contact or direct contact with the patients, but you collaborate and you coordinate with the patient, with the families also.
Exactly. So we do have programs that are destined to patients, to people living with mental health conditions, but also programs for what we call caregivers. These are usually family members who are taking care of a loved one who has a mental health condition. And we know that in our Tunisian society, the majority of the burden falls on families, and no one prepares them to deal with a person who has a mental health condition.
Yeah, concerning mental health, we in Tunisia, we have, I suppose, plenty of, let's say, difficulties or mental conditions that people go through. If you as a professional can assess what are the different types of mental health troubles or patients they come to you, I mean, the big ones or the most common ones.
What
Diseases.
do you think? What would be your guess?
I guess we are really very much stressed, and anxiety can be in the top of the list.
Yes, you are absolutely right. I think in our country we're not different actually from other countries in the world. It's mainly depressive disorders and anxiety disorders. We have also seen a rise in burnout and stress-related disorders in young people, but I think it's also important to make a difference between going through rough periods, difficult periods, and having a mental health disorder. These are not the same thing.
Of course.
And sadly, I think one of the big problems that we have in Tunisia is that we don't talk enough about mental health. So what could start as an occasional problem, for example, occasional sleep disorders or a period of sadness after losing someone, can turn into a mental health disorder if we do not intervene quickly, if we do not seek help. So I think that the big problem is the silence that surrounds mental health.
Exactly. I really love the thing that you're saying. So what is really important is that we have to raise awareness around us. We have to use media to raise awareness about the importance of mental health today in Tunisia, and to make people realize how important it is. As much as you are taking care of your food and taking care and going to the gym, mental health too is necessary. So are there any, concerning this unit, so far, how was the beginning of the consultations, or let's say of the therapies that you have been undergoing so far? I suppose activities started before. So concerning the first period from the 18th of October till now, so what type of activities have been organized and managed and planned?
Okay, excellent question. So as I said, we actually started way before. Our first session started in June, but we have been speaking about and talking to the media, like you said, from the 18th of October. What we have done so far is develop programs that are in Arabic dialect, Tunisian Arabic dialect, sorry. It was very important for us that people who come to our programs feel that they can speak their language, and we are not speaking a scientific language they do not understand.
Exactly.
So that was the first step. So far, we have a group psychoeducation program for bipolar disorder, as well as for depression. And we have also started slowly introducing, like I said, programs for caregivers and family members.
So they are well structured, as you said. So I mean, here the groups, when you are organizing them, how many are they? What are the types of activities they go through, and how long does it take to recover from any mental problem?
Okay, so our programs can last from 1 month to 2 months, and it's usually one session per week. We are still always evaluating our programs actually to make sure that they suit our population, but this is so far
It's a pioneering experience, so you are experimenting now.
Absolutely. And your question about recovery, that's a very good question, and it really depends on what you mean by recovery. If we are talking about having no symptoms whatsoever from a chronic mental health disorder, I'm afraid that is not the goal. The goal is to learn how to manage and how to live with a mental health disorder, with depression, with an anxiety disorder.
Should we understand that it lasts a long time?
It depends. It really depends on the mental health disorder. For example, if you're talking about a depressive episode, we know today that depression can be treated with the right medication, with the right type of psychotherapy. We know that it is possible. But for other chronic mental health disorders, it is absolutely possible to have a normal and fulfilling life while also having, like we said, psychotherapy intervention or treatment. It is really like any chronic physical disorder, I would say. For example, diabetes or hypertension, it is absolutely possible to live a normal life.
Exactly. We have the right medication, we have the right doctor, the specialist who can, control, let's say, the disease, and you can have through analysis, etc. You can live with it. As concerning the most efficient treatment or curing methods when dealing about psychological illnesses, so are there specific methods or curing therapies that are really have proved to be successful?
Absolutely, yes. And well, thanks to science and to medicine, we now have evidence-based interventions and type of psychotherapies that have truly proven to be either equal to treatments, medication, or sometimes even superior. That can be cognitive behavioral therapy, for example, which we have in our unit. It can be dialectic behavior therapy. There are EMDR, for example, so there are a lot of types of psychotherapies that are quite beneficial and have been proven to be scientifically proven to be effective. But I want to also take this opportunity to emphasize the importance of prevention, of taking care of one's health, either physical or emotional and mental. We know also, it has been scientifically proven that eating healthy food, taking care of the quality of your sleep, staying away from excessive social media, and surrounding yourself with a good group of people, I would say your family and your loved ones, that is also very beneficial for your mental health.
Exactly. And regular physical exercise.
Absolutely.
Because that's one way of, getting rid of all the toxins of your body. Or it can help you, relieve yourself from negative thoughts, and you feel that you're so relieved emotionally when practicing sports. So concerning bipolar, I'm happy to have a specialist here, because today we hear a lot, and there are let's say increasing number of people who declare having around them people who are suffering from bipolar, let's say,
disorder. Yes. So
can you tell us something about it, just to understand?
What is bipolar disorder, you mean?
Yeah.
Yes. So bipolar disorder is what we call a type of affective disorder. What does that mean? It means it usually is a mood disorder. That is, there are changes in the mood that we would call pathological, not normal. So anyone can have periods where they feel happy, or they feel sad, or they feel angry. That is not bipolar disorder. Bipolar disorder is comprised of episode in which there's, for example, excessive irritation or sadness that lasts more than 2 weeks, and that affects the person's functioning, either their work life or their family life, or etc. And so bipolar disorder is these episodes of depressive episodes, or either what we call hypomanic or maniac episodes, where the person is more overjoyed, more than usual, I would say. It is a chronic mental health disorder, and it is very important to get your diagnosis from a mental health professional. Like you said, today we hear this word and has been quite used, not in the right sense, I would say. So it's very important that you refer to a mental health professional for a diagnosis.
For the right diagnosis, okay. So here we come back to this unit. So here psycho-education. It seems it's like, do you think that we should include it as a topic in schools? Because we think, I really think and find it that it is so close to education more than it is a scientific approach. Is it important, or do you think is it a valuable or helpful means to include psychoeducation in schools, like clubs or something like that, in order to make young people aware about mental health in a way?
I see what you mean. Well, again, it depends what we mean. If we are talking about psychoeducation programs in their scientific definition, they are destined to certain types of mental health disorders, and there's a lot of thought that goes into creating these programs. So I do not think that it can be adapted to an academic framework, for example, school. However, I do think that we need programs that raise mental health awareness, that teach children or adolescents what are emotions, how can I deal with my emotions, how can I detect when I'm not feeling well, how can I ask for help, how can I take care of my mental health. So if we are talking about this definition, I absolutely agree with you.
Yeah, you are really right. So clear, crystal clear, the information that you are providing, and I'm really happy to have you here. Concerning the raising awareness, we know that it is important today, and we are speaking a lot about mental health today because people are really conscious that it is a part that is important in our life to take care of as much as the physical condition. So what are your recommendations for the common Tunisian people who are listening right now in order to be happy person, to live happily and healthy? I'm underlining the word healthy, being mentally or physically.
That's an excellent question. You know, Ms. Houda, I get messages several times a week from either family members or colleagues or even people that I don't know asking me for advice on mental health, either for them personally or for someone that they know. And 9 times out of 10, when people come up to me and ask me for advice on mental health, I can see that we could have intervened earlier. That means certain negative consequences and impaired functioning could have been avoided if they have sought after help earlier. So I think my advice would be, don't wait.
Exactly. Don't waste time.
Don't wait. Don't be afraid to ask for help. I know that we live in a society where stigma is very real related to mental health. I know that it is scary and it's not difficult to talk about when you're going through something because it can be seen as a weakness, but it is not as a weakness. So do not wait until there are sadly negative consequences. I would say ask for help. You can start with the people around you, just talking and seeking support, and maybe, if necessary, professional help.
Yes, if necessary, you have to seek professional help. And we know sometimes people they are ashamed to talk about these emotional troubles or mental, let's say, situation to close ones. That's why going to a specialist can help you so much. I mean, communicate the feelings and the troubles that you have. So that's why we have very excellent, actually excellent professionals, psychotherapists, psychologists, psychiatrists. We have this amazing hospital, Razi, where there are plenty of units working on different situations.
Yes. May I add something? Speaking about Razi Hospital, where I work, it is still a very stigmatized hospital.
Exactly.
And I want to personally, I want to thank my team, and I want to thank every mental health professional that is working in Razi, because it is challenging to work in a place that has such a negative connotation.
Exactly.
And I want to ask people to be a little kinder, because we have all these negative images on people who are following Razi. First, there are not just psychiatric units. There are other units, other medical specialties in Razi Hospital. And second, our patients are teachers, they are mothers, they are creative people, they are students. So don't these negative thoughts allow you to discriminate. Exactly.
Stereotyping hurts really.
Absolutely.
And everybody is exposed to any mental trouble. I mean, everybody is exposed to being stressing until the point that you reach depression, and anxiety can lead to mental troubles or mental health issues. So everybody is exposed to that. So don't stigmatize people. Don't put them throw stereotypes on them. So it's really already hard for them to manage their mental issues. So don't add to that the stigmatization. So thank you so much, Hend Jemli, coordinator of the unit of psycho-education and group therapy in Avicen service in Hospital Razi. Thank you for sharing this knowledge with us, because it's really important to take care of mental health of Tunisians. So what would be your message before ending?
Thank you very much for having me. I'm very happy, and it is my pleasure really to be here with you. So I want to invite people who think could benefit from our psychoeducation program and group psychotherapy to visit our Facebook group. May I?
Oh yeah, of course.
Yes. So there is PAP, Programme Avicenne Psycho-éducation, where they can learn more about what we do and what help could we offer them. So I think that is my final message. I hope that we can be of help for anyone listening today.
Wonderful. Sharing is caring, by the way. And here it is. There is a social network where you can get in touch with these professionals. Probably you can send them messages. They can answer you right away. Why not go and check on these professionals in Razi Hospital if you have open days or something like that? That would be great for people to contact you and get in touch with you and learn a little bit more about it.
Yes, absolutely.
It is possible.
It is very possible.
Thank you so much, Hend Jemli, Dr. Hend Jemli, psychiatrist. So here it is. So we are speaking a lot about mental health, but it is really important. And I like the word that Dr. Hend said all the time. Don't waste time. Sometimes we can avoid big issues just from the beginning by adopting the right therapy, doing the right things at the necessary time. So don't waste time. Thank you.
Thank you very much.
Back to music now.